Hey everyone, my name is Mallory Watson, and today I'll be talking about the accessory soleus muscle. Before we dive in, I just want to briefly explain what an anatomical variant is. Anatomical variants are natural differences in the structure of our bodies. Things like extra muscles, different shapes of bones, or slightly changed positions of organs. They're not abnormalities or diseases, they're just small variations that make each person's anatomy unique. I chose to present on the accessory soleus muscle because I thought it was fascinating how something so small and rare can actually be mistaken for a tumor on imaging or even cause pain in some people. Plus, as someone who's going into the medical field, I think it's important to recognize how these variations can impact diagnosis and treatment. So, with that being said, let's get started. The soleus muscle is located in the posterior compartment of the leg, right behind your lower calf. It lies deep to the gastrocnemius, which is the muscle that gives your calf its shape. The soleus originates on the back of the tibia and fibula and joins the gastrocnemius to form the Achilles tendon, which attaches to the heel bone or calcaneus. Even though it's not as visible as the gastrocnemius, the soleus plays an equally important role in lowering leg movement and stability. Now let's talk about what the soleus actually does. The primary function of the soleus is plantar flexion, which basically means pointing your toes downward. You use this motion at all the time, whether you're walking, running, or just jumping. The soleus is also considered one of the main postural muscles in the body. It helps maintain standing balance by preventing you from falling forward when you're upright. Even when you're just standing still, your soleus is constantly working in the background, stabilizing your ankle joint. It's sometimes called the anti-gravity muscle because of how much it contributes to keeping us standing upright. So while it might not be a muscle we think about often, it's one we depend on constantly throughout the day. So now that we've covered what the normal soleus looks like and what it does, let's talk about the accessory soleus muscle. This is an extra muscle that forms near or in front of the Achilles tendon. It can come from the fibula, tibia, or even from the main soleus muscle itself, and it usually inserts on either the calcaneus or the Achilles tendon. Basically, it's an added piece of muscle that doesn't exist in everyone, kind of like nature's little bonus feature. It's considered an anatomical variant, meaning it's not abnormal, but it's also not present in most people. The accessory soleus can appear on one leg, which is called unilateral, or on both legs, which is called bilateral. Even though it's rare, it's a really interesting example of how the human body can differ from person to person. The accessory soleus muscle isn't something you see every day. In fact, it's been reported in only about 0.7 to 5.5% of the population. What's interesting is that males are more likely to have it on one side, while females are more likely to have it on both sides. It's usually found by accident, either during an MRI, a surgery, or even a cadaver study. Because it often doesn't cause any symptoms, a lot of people who have it never even realize it. This muscle has been documented in both radiologic and cadaveric studies, and most of the time, it's completely asymptomatic. So why does this muscle matter? Even though it's harmless in most cases, the accessory soleus muscle is important to recognize because it can easily be mistaken for a soft tissue tumor on imaging. If a radiologist or surgeon doesn't realize it's an anatomical variant, it can lead to unnecessary concern or testing. In some cases, it can cause pain, swelling, or feeling of tightness in the lower leg during physical activity, especially in athletes or runners. That's because the muscle sits in a tight space, and when it enlarges during exercise, it can press against nearby tissues and cause discomfort. It can also interfere with venous drainage or make ankle surgery a little more challenging if the surgeon isn't aware that it's there. Usually, treatment is conservative, things like rest, stretching, or physical therapy. But in rare cases, when it's really painful or causing problems, surgical removal might be considered. To wrap everything up, the accessory soleus muscle is a rare anatomical variant that most people will never know they have. It's usually harmless, but it's a great example of how anatomy isn't always one size fits all. Understanding these kinds of variations helps healthcare providers make better diagnoses and avoid confusion during imaging or surgery. I think learning about the accessory soleus muscle really shows how complex and unique the human body is. Even something as simple as calf muscles can have fascinating differences. Thank you so much for listening to my presentation.